Another important role that pharmacist has to play is the procurement and storage. As we have seen that sometimes the medicines become shortage in the market. So in this shortage of drug, patient suffers a lot, and pharmacist has to play a role in the procurement of the medicines or drug to avoid the manufacturing shortage of the essential drugs. This is a very important role of the pharmacist to ensure the availability of drugs to the patient all the time. Another role is to proper storage of medicines, because the conditions like temperature, humidity and lighting vary from location to location. So to ensure its chemical integrity or to maintain its full dose activity, he has to play an important role in the properly storage of the medicine. Most important problem is with the look alike or sound alike drugs storage, and that are also known as LASA medications. Their improper storage leads to or have an impact on the proper dispensing. There are a few examples of sound alike and look alike drugs. Sound alike like hydralazine, hydroxyzine, gabapentin and gamifibrosil, carbamazepine, mirtazapine. And there you can see look-alike examples like timolol maleate and levobunolol. Both have same packaging, so it is very confusing for the patient. So to avoid the mistake, error or dispensing error, the proper storage of such kind of medicines is very essential. Pharmacists and this sport staff have to store these LASA physically apart to ensure the proper selection to avoid the dispensing mistake. Pharmacists can play an role in this, like he can use special font or size on the labeling and applying warning ancillary stickers on the final dispensed drugs. So next is the preparation. Sometimes we have seen that at the pharmacy ready-made medicines are not available, so pharmacist has to prepare that medicines and then he or she dispensed to the patient. So some medications like simple solutions or suspensions that can be prepared by the addition of water to powder, that these are very simple preparations and don't require any kind of special techniques. But specific creams and ointments have to be prepared with a special procedure, like to ensure that there is the right concentration of active ingredients throughout the preparation. Throughout the preparation, pharmacist has to play a proper role in the preparation of these medicines. The pharmacist has to play a role in dispensing. During dispensing, he has to take a review of the prescription and the preparation. He has to dispense the medicine with proper packaging and labeling, then to keep a record of that and transferring of the prescribed medicines. The most important role that the pharmacist has to play during the dispensing is the counseling. He has to counsel the patient or their patient's agent or another person who is responsible for the administration of medicine to the patient. The pharmacist should ensure that the prescription is valid, medicine is clinically appropriate for the patient, and the information is provided to ensure safe and appropriate use of the medicines. Administration. Although it is not the role that the pharmacist has to play, administration is basically associated with the nursing, and it is a nursing mainstay, especially for the parenteral drugs. But nowadays specific training is provided to the pharmacists for the medicines administration, like a medicine administration pharmacist MAP is a pharmacist who has specific training in medicine administration. This is a new concept, and with the usage of this concept, the patient's safety is improved, because through the medicines management and optimization and providing medicines in a timely manner and eliminating the missed doses, the patient's therapeutic outcomes are improved. Monitoring and evaluation, and the last step is the monitoring and evaluation. Drug therapy monitoring is not a single step process. It is an ongoing process, and pharmacist has to actively review the patient records. He has to identify and resolve the drug therapy problems such as adverse drug effects, and he has to communicate with the prescriber if any kind of problems occur. And pharmacists have to educate the caregivers and about the potential adverse effects. He has to work with patients to ensure adherence to the therapy and attainment of therapeutic goals. So there are basically 3 steps of monitoring. First step is the education of the patients about their therapy. He has to educate the patient about the potential adverse effects, and if adverse effects takes place, what type of actions the patient has to take, and regular assessment of the patient's drug therapy. And second is to ensure that the patient takes their medications as prescribed, and during this process he has again to identify and resolve the adverse drug effects and assess the therapeutic effectiveness. And secondly, he has also ensured that lab tests or appropriate labs are done and assessed. Number 3 is the with the data that is excluded from the above 2 steps, adjustment of the therapy is to be made based on the information from the monitoring process. So this was all from my side. Hope you have enjoyed that lecture. Thanks.